Hi, I'm William Porter McRoberts, MD, and if you're watching this video, you're probably thinking about or are about ready to have a procedure with me. So this is a quick video to kind of bring you up to speed about all the things to think about and be aware of prior to a procedure. So I'm going to talk about authorizations, where do you go, driving, how to get here, what to expect, pre-procedure prep such as eating and drinking, blood thinners, and of course complications. I'll try and be quick because I know your time is valuable. Thank you. So authorizations. As you know, many insurances require it. We will not get reimbursed if we don't get it. It can be onerous, as you've probably experienced. The aim of the insurance company is to keep you from getting what you need. That's how they keep their money. Bizarre business model, nevertheless. Even Medicare for things such as a facet joint nerve block and or ablation will require authorization. We're getting very good at this. Very rarely do we get denied now. We're figuring things out, but if things are languishing, I want you to please call. And the way the phone tree is set up presently, it's only two buttons. One, to make an appointment to see me. Two, to get in touch with the office staff. There will be a third button. It will take you directly to the authorizations department so you can check on what's happening, because it's rude and bad medicine to have you sit out there, in my opinion. I want you guys to know. So please do call. And if you're not getting anywhere, call again. I want you in getting these procedures as well. So, but keep in mind, they're going to take a little time to get, and please be patient. If you haven't heard anything in a week or so, please call again and spur them on. I don't want you to sit out there, especially if someone actually got the authorization, which I'm afraid has happened, and didn't let you know. Okay, where do you go? There's three places of businesses, or business, I do business. One is the main hospital. Come the week of February 12th, today's the first day of February, allegedly and hopefully we'll be doing our procedures in the labor and delivery section of the hospital. That hospital is on the corner of Federal and Commercial. There's entrances both from Federal and from Commercial. You go to the front of the hospital facing east. The main entrance, there's valet there, free valet. You go in, register, and then you're going to go to the second floor. You'll tell them that you're going to have procedures with us, and I think as the first few days or weeks, you're probably going to have some blank stares, I would imagine. Tell them also labor and delivery, and they might spark up and get you in the right place. Hopefully there's good signage, I'm hopeful, but that's the first place I'll be doing business. But that starts on the week of the 12th, hopefully. The second place of business is likely the place you've already been, which is here where I am now at the Holy Cross Healthplex, which is on North Dixie, 5597 North Dixie. The way to get in to see me for a office visit is through the D entrance. But if we're going to do a surgery or if we're going to do procedures in the next few weeks, you'll be coming around to the north side of the building, entering through the 1056th Street entrance, going in through the bottom level, going up to the second level, where you will find our procedure room, and then also what is known as the POSC, Physician Outpatient Surgery Center, which is where I'll start doing most of my surgeries. So if you're having a spinal cord stimulator implant or a fusion of the SI joint, lumbar, any of these big procedures or surgeries, that's likely where we're going to be doing it. In cases where we don't have coverage through Holy Cross, I'll be doing them at the Coral Ridge Outpatient Surgery Center, which is right down the street. Somewhat confusing, but very close. And I'll show you that on this map that I'm going to show everybody after I get done with this. So that's where you go. Please come half an hour prior. That makes it much easier to get everyone through and done in a timely fashion. We got to sometimes start an IV on you if you're having a certain procedure, put your info into the computer, etc. It makes it so much more smooth if you're on time, then I get to be on time for everyone else. So driving, how do you know if you can drive home? Obviously to the procedure, most people can do it. Driving home, that may be compromised by some of the procedures we do. Using an Uber is okay, or a Lyft. That's fine. That'll get you home. But as you can imagine, if in this litigious South Florida area, you were to have an accident, first thing those attorneys would do would try and sue the hospital or me. And I don't particularly want that. And quite honestly, I don't want you to hurt yourself. If you have an epidural, no driving. If you have any neuraxial, like a spinal cord stimulator procedure, no driving. If you had a big procedure like a kyphoplasty or a vertebroplasty, no driving. If you've had a cervical epidural, no driving. If you've had a lumbar epidural, no driving. If you've had a cervical facet joint nerve block, even though this is outside the spine, if we do it on both sides, you will feel pretty foggy, and please don't drive. You won't want to, you won't even feel like it. And then lastly, some more complicated things like a stellate ganglion block or a more involved procedure, please no driving. When can you drive? You can drive when you're having a peripheral joint injection that does not involve the driving leg. If you're driving a stick shift, that's both legs. Or if you're having a dominant hand surgery or procedure like a hand carpal tunnel injection, and you need that to drive, please don't drive. So facet joint nerve blocks in the lumbar spine, you can drive. SI joint injections, yes. Hip injections, yes. Knee injections, yes. Why? Because they don't affect the nerves of the lower or upper extremity. Blood thinners, who can stay on them and who can't? At the end of this, I'll put up a list of all the ones that you should look for. They include the oral medicines, but also things like anti-inflammatories. And then also over-the-counter like turmeric or fish oil. The list is inclusive, so please have a look at that. And quite honestly, if you have a procedure, you should also have that list available. Please look at it. If you don't stop your medicine and you come in for, say, an epidural, we won't be able to do it. And with good reason, because we can have a complication, and the risk of complication definitely goes up if you're on a blood thinner. In fact, for every injection, it goes up. So if you're having a neuraxial procedure, what does that mean? We're putting the needle inside the spine, like a cervical epidural, thoracic, lumbar epidural, or a catheter inside the spine, like a adhesiolysis or a spinal cord stimulator. No blood thinners, please. But if you're having, say, a hip injection, a side joint injection, unless you're old or feeble, then you can come on, or you can stay on the blood thinner. Those blood thinners, you need to check with the physician who put you on the blood thinner. Sometimes coming off the blood thinner is far riskier than not. So let's say you had a metal heart valve and you're on Coumadin. Please do not come off your blood thinner. And or a recent stent or something like that. I want you to please talk to the referring or the writing physician and make sure that you have their permission before you come off the blood thinner, please. That's imperative. Things like Mobic, Celebrex, those types of anti-inflammatories, they're actually okay. You can stay on those right up to the procedure because they don't really thin the blood. Things like ibuprofen or naproxen, give me a day where you don't have that, 12 hours, 14 hours, something like that, and then we'll be okay. Eating and drinking. Good to do, but just not prior to your procedure. 2 hours, please, before the procedure, just because if you have a full gut, you're going to vomit lying on your stomach for a while. So give me 2 hours, please, no eating or drinking. If you have to take your pills, that's fine. 6 hours of no eating and drinking if you're being sedated. And the reason is that the risk of aspiration, of breathing in some of that vomit, if it happens, is much higher if you are a little bit out of it. So we don't want you aspirating food. That's a big league problem. 6 hours. Of course, if you need to take your pills or your medicines, take them with a little bit of water, that's fine. And 8 hours prior to surgery, same thing. Please be off your, or please don't eat or drink 8 hours prior to the surgery. So this brings us to the end and complications. So it can happen. I've been very, very fortunate, very lucky through the years to have really just a very lucky, clean approach. And I think it's because we're so attendant to doing the right thing and checking and making sure we do things well. There are complications we don't worry about, which are soreness and a little increased pain at the site and those kinds of things. That's expected. But the one main thing I'm really interested in, and I want you to call and be persistent if you don't get an answer, is if you have a neurologic change after an epidural per se, or after, say, a spine, anything in the spine. And if you have a change in your strength or sensation or bowel or bladder, I want to know. I want to know after hours. You can email me if you can't get through. My email is portermcroberts@gmail. Please do it. And if it's something simple like a soreness or anything like that, then it can wait, and that's fine. But the other complications are, of course, if you have an infection. That doesn't usually happen right after a procedure. It'd take a few days for those bugs to double, triple, quadruple, etc. In their numbers before you actually have an infection. So that's not something that happens right away. And then, of course, bleeding that doesn't stop. I can't think of an occasion where that's happened because we use pretty thin little things, but I want to know, of course, if that's the case. So I think that pretty much sums it up. I'm going to show you on our map the various locations you can find us, and then show you the list, and just thank you for having confidence in me. It is a real honor to take care of you. Thanks. I'll see you soon. Okay, so I'm going to show you how to get to us, just FYI. That blue dot is where I am right now. It's where I am in clinic, so if we see each other for an office visit, it's going to be where that blue dot is. And it's also going to be the place we do procedures for the next couple of weeks, and then I'll show you where the hospital is. Okay, so you can see I-95, there's Pompano Beach. So this is commercial, that's 870 right there. And we'll zoom in a little bit. And if you came in off of 95, you'd go east towards the beach, and then this is Dixie. Northridge Shopping Center is right here, the UPS there. You go take a left, and as I spoke earlier, there's a Coral Ridge Outpatient Surgery Center. So if we're having surgery there, we'll see each other there. But then we're in this building. This is where we do our work. It's on the corner of North Dixie and Northeast 56th Street. If you remember my old office, it was over here. But this is the entrance right here. So you can park right in this area. This is where valet is right there. But you go in there and you go to the second floor. That'll be orthopedics, look for orthopedics, and that's where you'll find us. Now this entrance over here is where you'd find us for the procedures for the next few weeks, or for a outpatient surgery center at the POSC, or Physicians Outpatient Surgery Center. It'll be right here. And you come in here, there's a little drive-through. This is where the entrance is. This is where the entrance is, right off of 56th Street. Thank you very much. Look forward to seeing you. So that sheet is a list of all the medicines and the timing. It's obviously, you can't see the entire sheet on that video, but you should have that sheet. And if you don't, please call us. Thank you very much again.